any of the following major health issues: heart disease, stroke, digestive problems, arthritis, cancer, kidney disease, breathing problems, nerve problems, diabetes, liver disease, headaches, depression, high blood pressure, recurrent infection, anemia, or substance use.
No.
Okay. How has your current health been over the past few months?
Amber, did you
Good.
go space or position?
Do you have any other injuries or medical conditions?
No.
Have you ever been
I have
admitted-
asthma.
Oh, have you ever been admitted to a hospital for that or anything
No.
else? Have you ever had any surgery?
No.
So have you lost more than 5 to 10 pounds in the past month?
No.
What types of physical stresses does your job involve? Any sitting, standing, walking, lifting, bending, climbing, desk work, large equipment, small equipment, or chemical exposure?
I'm a student.
Are you on a diet?
No.
Do you use any tobacco products?
No.
How many drinks of alcohol have you had do you have typically in 1 week?
0.
How many caffeinated drinks do you have in 1 day?
Today I've had 3 or 4.
Okay. Have you been experiencing any fever, chills, or sweats?
No.
Any severe night pain?
No.
Any unexplained weight change?
No.
Any unusual fatigue or just general tiredness?
No.
Chest pain, palpitations?
No.
Shortness of breath?
No.
Dizziness or lightheadedness or fainting?
No.
Nausea or vomiting?
No.
Loss of bowel control or diarrhea?
No.
Difficulty bleeding or pain while urinating?
No.
Sexual function problems?
No.
Visual disturbances?
No.
Numbness, weakness, burning, or tingling?
Nope.
Or any difficulty swallowing or hoarseness in the voice?
No.
Awesome.
7, 14, 21, 28, 30, 35, 70, 77, 84, 91, 98.
So I'm going to be testing your cranial nerves now. So first one we're going to do is olfactory. Do you smell this mint?
Minty.
Awesome. Okay, so can you read that title on that poster right there in the middle?
Oh, in the middle? Sorry. Understanding asthma.
Okay. Can you read what this says here?
Sports medicine.
Awesome. Okay, so you follow this finger, please.
Mhm.
We're testing your oculomotor and abducens with a lot of movement. Trochlear. I'm going to give you 3 to 5 words, and you're going to repeat them back to me. We're going to do this a couple times. So, house, koala, penny, cup, tree.
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 One more time.
House, koala, penny, cup, tree.
Awesome. And can you count up to 100, but in increments of 7? So 1, 7. Can you punch your jaw? Awesome. Okay. So for your trochlear, and can you feel this? All the same?
Yep.
Awesome. That's your trigeminal. So abducens, I already assessed that in the oculomotor screening. Facial. Can you please smile? And you frown? And can you scrunch forehead? Awesome. Auditory? Okay. So, do these sound the same?
Yeah.
Okay. How do these sound?
Yes.
And then glossopharyngeal, can you please fall? Vegas, say ah. Accessory, so do shoulder shrug and don't look completely down. Nice. And then glossopharyngeal, could you please get it done? Nice. We're going to be starting with your C4 monotone, and you're going to do shoulder shrug. Don't push down. Awesome. And then can you hold your arms out like this? 5. Awesome. C6, can you do bicep curl? Don't lay down. Awesome. C7, don't pull you up. Nice. Don't pull you up. And C8, so hold right there. So we're going to be testing your cranial nerves right now. So, can you do shoulder shrug, please? This is C4. Awesome. Hold your wings out. Okay, this is C5. And you can do bicep curl. This is C6. Nice. C7, can you put your arms down a little bit? Don't let me pull you up. Nice. Awesome. And can you hold your hands like this, please? Assessing C8. Finger flexors. Awesome. T1. Can you squeeze? Awesome. And then push up. Awesome. Okay, we're assessing L1 and L2 here. And could you bring your hands to the ceiling. Don't push it down. Awesome. Other one. Perfect. Okay, so it's L1, L2. You stick your leg straight out. L3. Nice. Awesome. So I'm assessing great toe extension, L5, and plantar flexion, S1. And now I'm assessing knee flexion for S2. I'm assessing dorsiflexion for accessory motor movements, as well as hand squeezes for motor strength. If you get off the table, please. And I just want to look at how you're walking, so just walk that way. Okay. There's no advantageous gait or compensation. And you can turn around, come back. You don't feel off balance or anything, do you? Awesome. Okay. And you can stop there. So you just balance on one foot. Yeah. Other side. Good too.
Yes.
Awesome. So we assessed your balance on a flat surface, and now we're going to assess it on an uneven surface. So if you put your hands on your hips, we're looking for errors such as flexing your hip laterally or anteriorly more than 30 degrees, bringing your foot off of the testing surface, being out of place for 5 or more seconds, as well as opening your eyes on the closed eyes section. Going to time you for 20 seconds. 20 seconds. And then can you do single leg on your non-dominant foot? Yeah. And can you put your non-dominant foot behind your dominant foot? You can go diagonally if there's more room. Awesome. And you're going to hold that for 20 seconds. Leg, eyes closed. Begin. And your non-dominant foot, get in position, and then when you're ready, close your eyes. Same thing, hand down, non-dominant behind your dominant foot, and then when you're ready, eyes closed. Could you perform a skater jump? Just going side to side and moving forward a little bit. Oh, okay. Motor is all good. Alright, so C4, C5, C6, C7, C8, T1, L1, L2, L3, 4, L5, S1, S2. So can you remember those 5 words that I told you before this?
House, koala, penny, cup, tree.
Awesome. Okay, great song. Okay, so your arms look similar in size, color, and you don't have any noticeable dermatological lesions. Okay, so radial pulse, strong, no variation. Brachial pulse, same. Radial pulse on the side, strong as well as brachial. And assess capillary refill. Okay, that's normal. Legs look similar in size and color and have no obvious dermatological lesions that you have noticed either. Awesome. Okay. Toes look cold. Do you have any medical conditions?
Raynaud's.
Okay, that's it. That's normal then. If you lay back, I'm going to assess your femoral pulse really quick, and then we're just going to have you pick up. So, oh, sorry.
No, that was, I think it was my sacrum.
Okay, that's strong. I'm going to do popliteal. So deep over range 7, please. And then flip back over on your posterior, slide forward, thank you. And we're going to assess posterior tibial, very strong, and dorsalis pedis. Posterior tibial and the dorsalis pedis are both strong and don't have any variation.
I am assessing the C5 biceps tendon reflex. And here I am assessing the C6 brachioradialis reflex. Here I am assessing the C7 triceps reflex. Here I am assessing the L3, L4 deep tendon reflex and the S1, S2 Achilles tendon reflex. Here I am assessing the posterior tib deep tendon reflex, and all of these deep tendon reflexes will be compared bilaterally to ensure no spinal injury has occurred.
Sharp.
Sharp.
Sharp. Sharper doll.
Dull.
Sharper doll.
Dull.
Sharper doll.
Dull.
Put your hands out. Thank you. Sharper doll.
Sharp.
Sharper doll.
Dull.
Sharper doll.
Sharp.
Sharper doll.
Dull. Dull.
Sorry.
Dull.
There you go. Yeah. So sharper doll.
Dull.
Sharper doll.
Dull. Bless you. Ooh, sharp. Sharp.
Yeah.
Dull. Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Woo.
Sharp. Dull.
Okay. The aortic zone we found at the third intercostal space, the sternoclavicular line. The pulmonary zone is at the third intercostal space at the sternoclavicular line. The tricuspid zone is the fourth intercostal space at the sternoclavicular line, and the mitral zone is at the fifth intercostal space at the midclavicular line. So mitral lobe, so there's a lobe dub. It sounds normal. Does not sound like there's any abnormal heart sounds or murmurs. And rate and rhythm of heartbeat is normal. There's no tachycardia, bradycardia, and the pulse is strong. Interior percussion. Looking for any abnormally dull or hollow. So for posterior percussions, here we go. Posterior auscultations, looking for vesicular sounds bilaterally. So take a deep breath. Take a deep breath. 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 More. One more. And then we're looking for bronchivesicular. I'm going more medial. Deep breath. Okay, anterior auscultations. So take a deep breath in. Take a deep breath in. We're assessing bronchial sounds here. Okay, now take a deep breath in. We're assessing vesicular. And also looking for incidences of crackles, bronchi, stridor, or any wheezing or friction. There we go. Good. Who are you? So thoracic cage does not look like there is any deformations or bruising or swelling, which is nice. So just keep breathing normally. Do you have any pain with that?
Nope.
Okay, so you have a normal rate of breathing, normal rhythm, and normal depth. There's no pain with anything. That's good. You're not cyanotic. Yep. You're comfortable in that position?
Yep.
You don't have any pain when lying down or standing up either?
Nope.
Awesome. Facial expression, you look calm. You're not using excessive muscles to try and breathe, and you are conscious, responsive, and answering the following directions. Okay. So skin temperature, normal. You're not clammy at all. And your rib cage is expanding correctly and symmetrically, and you don't have any lumps, masses, or do you have any tenderness coming down through here?
Nope.
Awesome. What over here?
Nope.
Nothing in the middle?
Nope.
Awesome.
Parts, and then we're gonna do the
Looking for the normal contour, no gross deformities or masses. You have proper symmetry. Your umbilicus looks normal. Your skin feels not clammy, not
We basically just have to,
hot
go through the whole
or
thing.
cold, and you don't have any unusual pulsation or movement in your typical breathing movements.
That's why it has to be.
So now we're going to auscultate for bowel sounds.
No, absolutely not. No, there's four groups.
And could you please hook lie? So just bring your knees up.
20 minutes each.
Thank you.
80 minutes.
Ooh, okay. So, looking for typical sound. Oh, have you eaten in the past, like, couple hours?
No.
Okay, so
Yes. I had coffee.
okay. So, looking for any like tinkling, whooshing. If there's like an absence of noise, that's not always great. But she also hasn't eaten in the past few hours. So we can hold this for up to 2 minutes to wait for vowel sounds. But I'm hearing a little bit. Abdominal percussion starting in the right upper quadrant. And can you put your hand above your head, please? Looking for the bottom edge of the liver, which is right here. Okay. It's in the typical spot. It doesn't seem to be engorged. Okay. And you put your hand back down. And I think right here. So, any pain with this? Good. Okay. Arms over your head, please. No pain with that.